All right, let's take a look at some of those protein and fluid need math calculation problems that you're going to use for this week's homework. So we'll be looking at hepatic status, renal status, to figure out their protein and fluid needs. Okay, so you're going to want to make sure that you have this handout here at the ready so that you can work through these problems with me. Okay, so what I'm looking at now is a patient that has chronic renal failure, CRF. They are not on hemodialysis or peritoneal dialysis, and they weigh 212 pounds. Okay, so let's work through this problem together. Okay, so first thing we're going to do is convert their weight in pounds to weight in kilograms. So 212 divided by 2.2, we're going to get 96.4 kilograms. Okay. Now, we said that they had renal failure, so they're going to fall here on this decreased fluids recommendation. So we're going to take that 96.4 kilograms and multiply that by 20, okay, the low end of this decreased fluids. And we get 1,930 milliliters of fluid, okay? If you want to, you can divide that by 240 to get the cups of fluid. So we have our fluid recommendation for this person with CRF. Now, let's get their protein recommendation, okay? Remember, they are a patient with CRF and they do not have any dialysis. So they are going to be below the recommended RDA for protein. So their protein needs are going to be 0.6 grams per kilogram of body weight. And we'll take their weight in kilograms, 96.4 times 0.6, and we're going to get the protein recommendation of 58. Okay. Now, let's consider that this same person, chronic renal failure, 212 pounds, but that they are getting dialysis. Their fluid needs are going to still be the same. They're going to be on a decreased fluid, but we're going to increase their protein needs from 0.6 to high protein 1.5 grams per kilogram. So you can do the math for that. All right. Now, let's look at another issue. Let's look at an 82-pound patient that is experiencing diarrhea. Okay, so first things first, we're going to do 82 pounds divided by 2.2, and we get 37 kilograms. Okay, because they have diarrhea, they're going to be in this increased fluid category. So we're going to multiply their fluid needs by either 30 or 35. Okay, so 37 kilograms times 35, you're going to get 1,850. Okay. So now when figuring fluid needs, we're going to not consider that everyone is going to be normal fluid needs. We're going to look at some of these comorbidities or these symptoms that are going to put them at either decreased fluids or increased fluids. And you'll do a lot of practice with that this week in your homework.